Hi, everybody. It's wonderful to meet you all. I wish I could be there in person in sunny California, but I'm currently in Boston for a graduation, and I'm excited to share about the innovative platform we've developed at Vital Start Health. Next slide, please. Everybody wants to hold the baby, but who holds the mom? That's the question we're addressing at Vital Start Health. We all know of the rise in maternal mortality rates, but it's just hard to believe that in the 21st century, moms are dying in the US. 80% of those deaths are preventable, and it can take up to 19,000 per mother for perinatal mood and anxiety disorders treatment, and up to 5 years. This is an enormous problem with clear unmet needs, and we want to disrupt this completely using a platform as well as human in the loop approach. Not just at postpartum, but the problem begins much, much earlier. That's what we've learned, and that's what the literature says. And so we are providing support to mothers right from preconception through birthing and postpartum. 90% of those going through fertility treatments have reported depression, and 40% of them will have high-risk pregnancy complications, and 26% will have preterm births. So there's a huge need to tackle this problem across the continuum. Next slide, please. And I know this, I'm passionate about this because I've been through this myself and come face to face with the stigma, the anxiety, and the discrepancies in the healthcare system. Next slide. And to address this, we have developed a unique platform that provides personalized, clinically guided, equitable care across the continuum called Courage, that has a program with stress reduction and stress inoculation. This is something new that we're bringing to the table here. Also has CBT with a practitioner in the loop. And all of this is measurable behavioral health using an evidence-based design and analytics and AI through a vital sign for well-being profile. Our focus is on providing affordable healthcare with screening, accessibility through telehealth, and of course, human in the loop, because we feel this is a very vulnerable journey. Next slide. Hi, everyone. I'm Kirthika Parmeswaran. I'm a Wharton alum with deep expertise across business and technology. I'm joined by Dr. John Cho, who is a neonatal quality officer at the Children's Hospital of Philadelphia and a professor at Penn Medicine. We are a Penn company with a stellar group of advisors funded initially through the Science Center in Philadelphia and supported through the Microsoft for Startups program. We're excited to go after this phenomenal opportunity with high impact and high needs. Next slide, please. This is a $50 billion problem globally. We always think of femtech as being something niche, but I want to say that's not the case at all. There's a huge awareness for the need to address this problem in $19 billion market in the US. And we are going to be looking at the core issues here, starting from fertility, high-risk pregnancy, and the NICU aspect in the postpartum. Next slide, please. We have achieved a lot of momentum. We've had numerous awards. We've raised a pre-seed round, we're raising our seed round, and we've seen great traction. They've onboarded in 2 clinics. We're speaking with a pharmaceutical company on co-development. We have doing studies at leading institutions in New Jersey and Philadelphia. We were invited to the NIH for a workshop last week. And I'm really proud to say that they engage both with advocacy groups, folks in the maternity ecosystem, and we have a lot of interest from the payer side as well. Next slide. What we're doing here is combining the 3. We have CBT with VR, using low cost and high-end VR as needed in a waiting room versus, at home. So we can address inequity issues. We're using a digital therapeutic approach with an evidence-based design with then practitioner in the loop. And finally, our focus is all about prevention. We all know of postpartum depression, the tough journeys. We all have somebody in our life that has gone through this, but we want to avoid women from getting through psychosis or postpartum depression. And that's why it's important this journey starts much earlier. Next slide, please. So now is the video. Please play the video.
Sitting in a comfortable seated position. Noticing your breath as it moves naturally in and out of your nose. You are at the beach in a serene, quiet space of love, calm, and peace.
Hi, everyone. I just heard that you couldn't hear me while the video was playing. So that was an overview to just show you how our platform works. It has both the stress education, the stress inoculation, which is psychoeducation, anticipatory guidance, really to drive performance under anxiety, as well as stress reduction. So you learn how to use these core skills. And the platform combines both the psychoeducation aspect as well as the stress reduction, along with assessments and screenings that we have been able to track over time as a longitudinal scorecard. And that portion is patent pending. That's what I was just saying, the vital sign for well-being profile. But what this allows us to do is provide the client and the provider, empower them with data, with these visual cues that a practitioner can provide to the patient, and the patient can use for experiential practice and reinforcement and learning. Next slide, please. This is what we really try to get at. The heart of this is integrated care. With maternity, with reproductive health, it's really clear, and the Milliman report talks about this as well. If there's a mental health condition, anything in physical health will cost 3 times more. So we want to drive to the heart of this to enable mothers who are going through this and would-be mothers and couples with that support that they would need. And we have a high-end approach at the waiting room of clinics, systems, and others. And we have a easy-to-use mobile VR approach over telehealth. So that way we can get the best of both worlds wherever the patient is. Next slide. And so we get this question a lot. What kind of clinical validation have you done? And I just wanted to share this. We began with the same question, why we are? So we did a focus group at CHOP with family partners, where we showed them YouTube versus VR, and VR one hands down. Of course, there's a body of evidence supporting VR, different conditions. Know that previous speakers as well have spoken about this. The American Psychological Association has come out and said that VR works really well for PTSD, OCD, stress, anxiety, depression, all of which fall under the perinatal mood anxiety disorders umbrella. And we're taking that forward, doing our own studies. Next slide. So we've done an IRP-based study at leading in the Children's Hospital of Philadelphia, and various trauma levels down for our patients. Now we're doing a follow-on larger study there. And with that, we raised around, built out a platform, did a pilot. We saw again, really great results, 20% reduction before and after a program. And we saw that both the practitioners and the clients really loved this approach. Next slide. We've built a lot of IP and, filed for patents as well throughout it, including multilingual content, toolkits, different sorts of algorithms to build the right content, because this is not TikTok. You can't just throw something in there and assume that moms will feel better. So we had to come up with a way based on behavioral science to build these videos as well that will give the right outcomes. Next slide. And I made this slide a little bit more like a picture, as you can see. That's because I want to drive home the point that femtech is not a niche. This is a real market. We need more help and support in this market. And you can see that different customers, right, from the providers, the systems, the clinics, the group practices, payers, employers, and pharmaceuticals are interested in this. And we are going to, we've launched a platform, we're commercializing in this space actively. Next slide. And we're using a very simple subscription-based model, whether it's a waiting room, whether it is, per member per month, or whether it is as a augmentation to a behavioral health practice. Next slide. What we're doing is truly unique. We have combined the best in experiential practice with the human in the loop, providing ability and care across that continuum right from preconception through birthday, postpartum. And that's why, that's the differentiation we bring to the table. Next. And enough cannot be said about the benefits that can be brought to this platform. Not only does this drive engagement, enables retries so that patients don't drop out of a fertility cycle. This also helps parents as they go through this journey without feeling that guilt, without feeling alone, focusing on self-care, not that identity crisis, and able to get back to work, be more productive. And of course, this is a competitive edge for the customer that's using this. And all of this is backed by reimbursements, which I think is going to be that key game changer for us. And of course, with Apple coming in with a VR headset, we think this space is now about to just explode. Next. And that's what we're using in our go-to-market strategy. We are looking at a two-pronged approach of going after the B2B, B2C, as a partner, already tested B2C, really high acquisition costs. So we're looking more at B2B, doing innovation pilots and partnerships. And if anyone in the audience is interested, please reach out. Next. We really are dreaming big. We want to be that Web3.0 platform that provides optimal mental health for all acute and chronic conditions beyond maternity, oncology, pediatric surgery, many other areas fall into this. Next. So what we have is something that you can stand by, really support us as we raise the seed round. We have raised a phenomenal amount of funding, won awards, stellar team, strategic potential, and the market is just growing in the space. It's the right timing and the right place. And we want to be able to impact 1 million families using our platform in the next 10 years, along with a health equity mission. I hope you join us and help us deliver joy as vital step. Next slide, please. Thank you so much. The question is regarding the importance of oxytocin production during pregnancy and if deficiency lead to postpartum depression. And if your brain experiences focus on optimizing oxytocin or other neurochemicals or hormones. Wow, that's a phenomenal question. And, I'm so intrigued by this whole space, this whole area, especially with oxytocin. So like a year ago, we got a dog and it was incredible that I was feeling that oxytocin release. And I started to wonder what is happening with me. Because, I finished all the childbearing. I'm on the startup, something wrong with me. And that's when I did the research. And it's clear now that, there's this phenomenal book, Mom Genes, as well, that looks at this research happening at Mount Sinai, usually looks at the same question. Why is that oxytocin released? And is it just at childbirth, post-childbirth, or can it be when an aunt meets a child, or there is a member of your family having a connection, whether it's with a pet or with a child? And the answer is yes. That's what they've discovered in the mice experiments that they've done, is that there is literally a genetic transfer from the offspring into the person who's giving them care. Any caregiver can be a father, a mother, an aunt, anyone. So that really is about the oxytocin release, and it's one way of nature to us connect. Now, our platform is all about providing interventions, the digital therapeutic, allowing digital methods, because we feel that not many moms postpartum want to get into any chemical methods. So that's our focus. And we can be an adjunct to pharmaceuticals and medication approaches as well. That's a lovely question. So, as a founder, what were your most memorable moments in your journey? This is such an amazing question because there's so much to talk. I think I can just talk for the rest of the day. And I'm sure there are many startup founders in this audience and you've been in my shoes. So you might have heard of the TED Talk by DARPA, where she said, you can be really well educated, you can have all the money you need, you can have a small team, but the most important thing that they discovered and makes people successful is grit. And I think that's it. That's what a startup founder needs. And for me, what has built that grit in me is looking at this whole journey as an unfolding. I feel like this is true, this is needed, this is going to happen. Even if I pivot, even if there are other issues that I have to, combine this with. But I feel so confident that this is going to be true. It's an unfolding, and I'm part of this journey. And there's been many ups and downs, many no's, but I know I'll get that yes. And I know that this is going to impact the lives, our vision and vital too, of impacting a million families. Thank you. Thank you so much. Have a great one.